Hi, my name is Amanda Schubert. Thank you all for joining in today. Some of you are listening live today. Some of you will be participating in our 2020 FCASV biannual summit. I'm happy that we were all able to meet virtually. Usually we meet live, and I'm grateful that we're still able to do this. We're still able to be together. I work at SPARCC in Sarasota. I've been a victim advocate, sexual assault victim advocate for 5 years at this agency. I've been in social services for 17 years, and I am going to be one of the presenters talking about vicarious trauma today.
Thank you, Amanda. And my name is Eva Fiallos Diaz. I'm the Rural Project Coordinator with the Florida Council Against Sexual Violence. I am physically located up in the Tallahassee, Leon County area, and am involved with the Rural Project Grant. And this is our second time, Amanda and I, on this grant. So we've been a good team for the last, close to 4 years now.
Yeah, yep, 4 years.
Yeah, so just some housekeeping items. If you haven't already put your email in the chat, please do so. Amanda will have a backup way to reach you and give you a certificate of attendance. You may also use the chat feature to ask questions, to give us feedback. If you prefer, there will be some time where you can be on live and speak directly to us. That's part of why we did this as a video chat as opposed to a webinar. So you could be on the screen and kind of interacting with real people as opposed to being lectured at, which I know can be kind of a turnoff, especially in the digital age. So thank you again for being here. In addition to working for the Florida Council, I am a licensed clinical social worker. And so a lot of what we'll be talking to you about today is as much lived experience as it is a direct experience from what we see in our agencies or what we've seen from past agencies. So thank you.
We want to thank OVW for making this happen. They are the funders that support our rural grant. SPARCC provides services in Sarasota, non-rural community, and in DeSoto, rural community. And that project is very, very special. We've had it, I think we've had it in total for 6 years. I've been a part of it for 5. And the idea for that grant is to be able to provide sexual assault services to marginalized population in the rural community. Specifically in DeSoto County, there is a big population of migrant farm workers. And of all the work that I've done here at SPARCC, I've learned so much from that county and the people, beautiful, beautiful people that work there. Even going to the hospital, it's like a hometown feeling, and it's a great county, but it is ran very different than over in Sarasota. They don't have even buses right now. Even before the pandemic, you know, it was very difficult for people to get around. So it's a unique county. And I'm grateful to OVW to provide this funding to us so that we can reach people who otherwise wouldn't be able to use our services. I do want to give a shout out, those of you that knew my DeSoto advocate, Ariana. She was a big part of this presentation, putting parts of this together, and a big part of this entire program, and she'll be very, very missed. But I didn't want her to be left out, even though she's not here today. She was very passionate about this topic, as am I, and I do wish that she was here, but I just want to give her some kudos. Today we're going to be talking specifically about vicarious trauma. I know that until I started working as a victim advocate, I did not know what that meant. What I'm finding out now, and especially when I look around the room and I see those of you, I know what you do in the community, we're all helpers. And there are effects of being helpers, and that's what we're going to talk about today. I got a quick video for you to watch. Hopefully everyone can hear it. No sound, Eva. The sound's really faint.
Is it better if I do that?
Mm-mm.
Okay. Let me just-
Evan, when you click screen share, there's a little checkbox down in that screen share that says share computer audio, and that will then broadcast the audio to everyone else's computer.
Okay.
Technical difficulties is something new. I joked with Eva earlier. I was like, I think this should be part of the pandemic pay. We all are learning to be like DJs and technical types of folks.
There you go.
A school teacher,
Is that better?
a public defender, or a member of the military. So why does the world feel like a different place to you? Maybe you're an ecologist, a doctor, a community organizer, or a caretaker to family members. It's all piling on, and some of your own choices could be starting to raise eyebrows. Let's face it, these days, when the world comes calling, you'd really rather not pick up. Your mind, blown. Your spirit, broken. And your body is not taking any of this all that well. Something's just not how you remember. And that something could, in fact, be you. Hey, it's a struggle. We understand that. Doesn't mean it's too late for a change. We're here. We get it. And we have ideas for how to find a better way. Check us out. TraumaStewardship.com.
So that made me laugh because it goes with the topic of burnout, which we're not going to be talking about today, but I want to acknowledge that it is different than vicarious trauma, but it is a real thing. Burnout is when you are just done. Doesn't have anything necessarily to do with the actual work that you do with the people that you help. Typically, it's prolonged stress and frustration with sometimes maybe the agency where you work, maybe what you've been doing for so long. This is the feeling, the best way I can describe it is, this is when you're at Publix and you're like, you know what, I'm gonna buy the cake and I'm gonna put on there, I quit. I'm gonna pay someone to deliver it to my boss's desk. That is burnout. That is when you are like, I'm gonna send them a glitter bomb card, they're gonna open it, glitter everywhere, and it's gonna sing, and it's gonna say, I'm done, I quit. That's burnout. We're not going to talk about that today. It is real. I want to acknowledge it, have space for it at another time, not today. I want it to be, make sure that it said that it is different than vicarious trauma. You see the little Superman, he was laying down and he was like, hey, they're all emergencies. What a world it would be if that's how Superman was in the comics, right? He wasn't that way. Another trauma, institutional trauma, I like to call it organizational trauma. This is, it's little bit, it sounds like burnout, but that's when the external systems outside of where you work, maybe sometimes in where you work, maybe the people above you, there's no flexibility, there's not responsive, there's not support. You got to play the politic type of game to get your job done. You know, that can be very traumatizing to people. And sometimes people can push through, and sometimes people, then it easily turns into burnout. We're like, okay, we're going back to the cake. Let's get the cake. I'm done. I can't do this. And the place where you work has caused some type of trauma. Again, I want to have space for that. That is important. That happens to people, but that's still different from what we're talking about today.
And I think that worthy of mention, along with institutional trauma, are systems of repression that are often interwoven into those institutional situations. And so kind of want to look at that from multiple lenses as well, even though what we're talking about specifically today is vicarious trauma. Okay, so speaking of what the differences between burnout, compassion fatigue, and compassionate stress are, to get into kind of the weeds of that, when we talk about compassion fatigue, it is something that is a result of compassion stress. So whereas stress is sort of an everyday experience where you find yourself tapped out in terms of what your resources look like emotionally and mentally, compassion fatigue is kind of extending that over a long period of time. So just to kind of throw out a question there, how do you think compassion fatigue is different than burnout? And I guess I can, if you raise your hand, it should pop up for us, or you could type into the chat if you prefer.
Ask your question one more time, Eva.
So how do you think that compassion fatigue is different than burnout? Or is there a difference? I'll give you a clue, there is a difference. All right, thank you, Maria. So Maria says, compassion fatigue is a predecessor to burnout. Okay. Burnout is after a lot of fatigue. Okay. Thank you for sharing those. So I think that often, you know, just like there are languages that we have to learn around, like I like legalese, for example, right? Like I don't speak legalese, right? So I think that therapy is very much that way. We coin all these terms time and time again, and often like the meanings and the nuances kind of get lost, particularly when a term becomes really in vogue. And burnout is one of those words that like is often in vogue and almost gets kind of called up in situations of just dire stress. And so I'll hear people say like, I'm so burnt out all the time. And I'm like, are you really? Or are you just using that in like sort of layman's terms? Like, and most of the time that's how they mean it, right? Like when you're having a conversation with your friends, with your family members, and they're talking about how burnt out they are. So burnout is a term that has been used since the early 1980s to describe what is a physical and emotional exhaustion that workers experience when they have low job satisfaction. They feel like they don't have a lot of power, a lot of say over the conditions that they're in. However, burnout does not necessarily mean that our view of the world changes, right? And so Amanda mentioned earlier, often with burnout, you can decide, okay, you know what, this particular job is one where I don't feel like it's going to change. I feel like I'm going to be subjected to these conditions over and over again. And so I'm going to look for a new job. And that with burnout is enough to shift, to create change, and to give you a new sense of renewal and like almost like a new start. Compassion fatigue, on the other hand, does not. Like that's not something that's easily resolved by switching jobs or by more self-care. And so here to talk more about that is Amanda.
What we are going to talk mostly about today and focus on is vicarious trauma. And as I started to do my own research, as part of, you know, the grant, they have us do a lot of research about a bunch of different topics. And I was like, you know, this topic, I don't want it to be doom and gloom. But as I started to talk to people, survey people, and do research, it can feel a little like doom and gloom. So I found a quick video to kind of make it a little bit light and kind of break it down real easy. So we'll play that.
When working with a service user, we don't always see what is going on behind the scenes. For example, our brains are complex things. And if someone has experienced something horrible like sexual abuse, neglect, domestic abuse, physical abuse, emotional abuse, or maybe even attachment issues, sometimes that can pass on to our brain. And the effect on us can be remarkable. Those feelings that person's told you then start to impact on us. And this is all due to empathy. We need our empathy when working with other people to understand what they're going through. Although using our empathy can take a lot out of us, and we need time to let our empathy recharge. If we don't give our brains a chance to recharge, we can experience something called vicarious trauma. Vicarious trauma means you start to be impacted by that person's trauma. You start to get negative effects from this. This can have a huge impact on you as a professional and as a person. Some of the signs that may be hitting you can include feeling hopeless and helpless, can't do enough, hypervigilant, diminished creativity, trying to simplify, trying to minimize, avoiding things, exhausted, unable to listen, dissociating from things, persecution, guilt, fear, anger, cynicism, cannot empathize, grandiosity, addictions, and potentially so much more. Either way, it can have a massive impact on you and can lead to you not wanting to do this role anymore. Therefore, is this the cost of caring? If we do not look after ourselves, potentially yes. However, the good news about vicarious trauma is that we can identify it and do something about it. To do this, we need to make sure that we have effective strategies in place at work, in our personal life, and to ensure that these things are ongoing and effective for us. If we think about our work life, for example, we need to be thinking about the culture of well-being. You never know when someone is going to open up to you about their traumas and past experiences. Therefore, we need to create a culture where it's all right to talk and reflect. We also need to ensure that we have an effective work-life balance. And outside of work, we're doing all the things that we enjoy and spending the time with the people that we love and care about. We need to make sure all our strategies, both in work and out work, are ongoing and not seen as a quick fix. Whatever strategies you have in your workplace, they need to be able to meet your needs. If you don't think something is, or you feel like you need further support, you should ask. Understanding that vicarious trauma exists and understanding the warning signs that you may be affected by means that we're able to do something about it to ensure that we feel happy, supported, and able to continue help supporting vulnerable people.
I think that as helpers of people, a lot of us we have different backgrounds, and so I'm including advocates. I'm including our HIV workers. We've got some nurses in here. We've got a couple different backgrounds. We've got some people from the Healthy Families program, all helping people. And in this helping profession, I think it's easy in the helping profession. We sort of look at other professions and we think like, man, they really should get some help. What they do is hard. But when it comes to us, I don't know where the stigma comes from, but it is there and it is real about what about us getting the help that we need and acknowledging that we do inherently become traumatized from time to time, or can be, based on the things that we hear and the experiences that our clients, participants, patients share with us. And there are consequences of that. Vicarious trauma and compassion fatigue, there are unintended consequences of being a helper. It's not something that anybody signs up for, but I would dare to say that every person in the helping profession at some point in their career will experience vicarious trauma. And I don't think it's something that's talked about. I know I certainly did not hear the words vicarious trauma in my undergrad, not one time. I got my degree 10 years ago, and that was not a word. That was not a thing that was being talked about. And it wasn't until I became an advocate that it was discussed. And really, it wasn't until it was a lived experience for me. And so what I did over the last couple of days is I surveyed a couple people that I work with, people that I don't work with, different people in helping professions. And I explained to them very briefly what vicarious trauma is. And I asked them if they would be comfortable to share with me an experience that either they have personally or they have heard of. We all go to a lot of trainings, we hear a lot of things. And so I asked them, you know, have they been affected by vicarious trauma? Would they be willing to tell me about that? And I shared with them my experience. And here's how I shared with them. I let them know that my very first Florida Council Against Sexual Violence Summit in 2016, you know, I was a couple months into my job. I was like, I'm ready to do this. I'm excited. I love this job. I love these people. I love what I'm doing. Yay. Sexual assault is bad. I'm an advocate. You know, I was going into that summit like with all the things that an advocate does. And after the first day of training, when I got back to my hotel room, I was physically fearful and startled. And I've been in social services for a while. I did home case management. I feel I'm tough. I'm good. I did it in very urban areas. I'm from Cleveland, Ohio. I lived in the projects. I'm tough. And that night I found myself like checking the locks, not just like normal checking the locks, like checking the locks like 8 times and checking the window. And in the hotel I was in, and in most hotels, the windows don't open. But I was like checking around the room, looking in the bathroom. I'm like, okay, you're acting weird. And it wasn't until after the summit when I came back, I was having a supervision. My boss asked me, how was it? And I was like, you know, and I broke down in tears. And I said, I'm really, really bothered. And I was lucky and fortunate to have a supervisor at the time that I could unpack that with. And she is the one who shared with me what vicarious trauma is. And what had happened was I was listening to a survivor tell a story where she was assaulted. She was sexually assaulted by a stranger, taken from her home as a young girl, taken for some time and sexually assaulted. And I had spent the beginning of my time at SPARCC really trying to make sure people understood, like, you know, sexual assault happens more often with people you know, and I was running with that. And that is true. That is statistics. That's what we find. But in that, I forgot that there still is stranger rape. And for me, and in my experience and in my brain and my life, whatever caused my brain to attach to that, it did. And I was like terrified someone was going to break into my room. Even when I got home a couple days later, there was like a raccoon on the screen, and I was like, someone's trying to break in. And like, you know, it was a wild experience for me. I was lucky to be able to unpack that. And I realized at that moment that for me, when things bother me, I need to be able to unpack it with a professional. I don't like to take it home and then I feel better. If I had not done that, or I did not have a supervisor who acknowledged that, I probably to this day would not be here. What I found when I asked some of my colleagues and different people outside of my agency to share with me, I said, tell me how you have been affected by vicarious trauma. What I noticed is people, almost everybody, right away went into the details, the very horrible details of what the person said to them and what they absorbed. And a couple of them I had to ask again or go back to and clarify, but how did that affect you? And I think that we're so good at helpers that we always think about other people first before we think about ourselves. And I had to sort of challenge, like, but what about you? And then that's when people described to me, you know, having nightmares, what the actual trigger is, what it is that bothers them, being concerned about their own safety after helping survivors. You know, are they going to be outed as an advocate and is someone going to come to their home? Dealing with very high lethality cases and seeing people physically torn apart, that really causing a toll on the helper to the point where they're crying and they don't know why. But getting people to get to that nitty gritty was a little difficult with some people. Not all people. Some people right away were able to send me a nice package of, this is how I dealt with it and this is how I do deal with it. But I think it's hard as helpers, like I said, to identify how is this affecting me, because we are so busy help, pouring from our cup, and then we're empty, and sometimes we don't realize it. The slide that you're looking at now, what I like about it, this graphic is it shows a spectrum of responses. When we deal with people with trauma, what do we say? There's no right or wrong way to respond. You can respond in any way. I broke this down for myself very simply as there are 3 ways that people can respond, helpers to vicarious trauma. One way, very negatively, it affects them, and then they're having the nightmares, and they're finding themselves being traumatized, maybe in even ways that their client shared that they're traumatized, and that causes the compassion fatigue. And then there's the second way, which is neutral, impact management. You're able to effectively manage what happened with you, and some things we're able to do that faster than not. And then, some people, when they are exposed to work-related trauma, they're able to handle it positively. They're able to have resilience, and they're able to, when I describe my job, people always say, wow, that's hard work. And I always say, well, I got a stomach of steel. And there are some things I think, we deal with, and we have resilience. But it's not always that way. But we don't always want to talk about it. But I'd like Eva to talk about, she had some really good points about resilience.
Yeah.
About this earlier.
Yeah, and I think that when we're talking about, because I know that we have folks who are not advocates on the call, and I think one of the benefits of coming from a mental health background is that we do receive training on how to do that, where we recognize that in a lot of professions, like law enforcement is doing a lot more now with, and I think there's a way that you talk about traumatic stress, for example, especially after like shooter involved like incidents, what happens in those moments to law enforcement, and why there's a window between a shooting incident and like when you're supposed to give a statement and et cetera, right? Like, and it's all centered in trauma and the experience of trauma in the brain. I think we're also finding a lot of that around combat veterans. And so what we know is from the way that we've already internalized past trauma, our brains can be reactivated to that trauma. And if you're human and you're living in the world, you've experienced some kind of trauma in your lifetime. I think that what makes a difference is if you're in a profession where you are encouraged actively to speak about how vicarious trauma is impacting you, again, that becomes a protective factor for you. And so I did a training I think it was like a year and a half ago, with human trafficking survivors who are now peer support for new human trafficking survivors. And so essentially they're survivors helping survivors. And so I can only imagine that the experiences that they're hearing about secondhand are going to trigger their own trauma, right? And so how do you support people who already have those lived experiences of trauma and so one of the things is I talk about it as like being an umbrella. And so if you're stuck in a storm, let's say it's a heavy storm, and you've got an umbrella with you to protect you, and so I kind of build an umbrella in my head, and I'm like, okay, what are the things that make up this umbrella for me? Is it like, okay, when I notice that I'm getting to a point in where I'm hitting a wall in terms of how much compassion I can have in this situation because I'm becoming really negative. I'm starting to see the world through a lens of like, wow, people are just horrible. And I no longer feel like I can trust that there are good people out there. That's kind of an indication to me. So one might be like recognition, right? Like knowing the signs of like, ooh, there's something coming up for me. And Amanda's going to talk a little bit about that later, about like trusting your instincts and knowing yourself. But there are other things. It might be that your family notices a change, right? And so instead of gaslighting your family member and being like, I'm fine, it's like, oh, I wonder what that's about. Like approaching things with a sense of curiosity about what is coming up for you, particularly if you haven't been taught that it's okay to be in tune with what you're feeling. It can be difficult and it requires practice. But it's very important because it's what's going to keep you healthy and sane and able to do the job that you're doing. And so that umbrella may have different things on it, right? It might have like family support, it might be your faith community, it might be um, whatever it is. Like, you know, I baths, reading a good book that has nothing to do, like maybe a fiction book that has nothing to do with like as a professional, I find that I'm reading a lot of nonfiction, and that's not helpful right now, right? Like if the world is in a state of chaos, and then I'm reading about more chaos, like, you know, turning off the news. It doesn't mean that you're not going to be impacted, because just like in a rainstorm, right, you can still get wet, and you're gonna feel the effects of it, but you're gonna mitigate a lot of the effects of that trauma. And so it's, you know, it's a lot of it is a lot of early prevention around what you can do and recognizing what's happening to you. And again, if you're not in an environment where you can do that, like what can you do to start building some of that support for yourself? Did I capture that,
You did,
Amanda?
thank you. You did, you did. The next slide is a long list, and I'm never going to read a PowerPoint like the whole list. I don't want to ever do that to you all. But when you think of the little video that we just showed, it talked about what happens to people. You know, fear, maybe dissociation. They become maybe less predictable. Maybe how you are, overeating, undereating, sleeping too much. Not sleeping at all, you know, thinking about your clients, patients, participants all the time, being consumed. That kind of reminded me of, you know, how when you're watching TV and they're advertising a new medication and they're like, this is great, this is gonna save the world. And then they get real low and they're like, however, the effects of this are gonna be like, you're never ever gonna sleep again, you're gonna have severe diarrhea, and your hair is gonna fall out, possibly, and your skin color may change, and you'll never be able to travel again. But this medicine's gonna be great. When I read this list, it's like if someone had handed me this my first day of like social work school or my first day of some jobs, I would have been like, I'm not doing this job. I'm not, this is not what I signed up for. But unfortunately it is something that happens. It's if you're dealing with people who have trauma, this is something that is a fact, you know, that may come into your career. Go to the next slide, Eva. Here's some behaviors. I like this slide. Talks about the behaviors of maybe prolonged vicarious trauma if we don't maybe deal with it, if we don't unpack it. Anybody ever moved? I just moved 2 weekends ago. I got boxes all over my house. And my coworkers are so supportive. They ask me every day. They're like, did you get some unpacking done? And I'm like, no, I'm tired, I didn't. And when it comes to vicarious trauma, it feels the same way. You have all these boxes of things and you have to literally unpack it. You have to open these things. And here are some of the behaviors and consequences. Maybe frequent job changes, tardiness, free-floating anger, irritability, exhaustion. Some of you, as you looked at this list, you might be like, well, no, I just feel like this right now because of the pandemic. That might be true. And so this is a little different. But I'm talking about if we really get real about what's going on and what our feelings are in relation to what's going on with what we are absorbing from the people that we help. Did you have anything that you wanted to add to this one, Eva?
I don't think so. I'm thinking about, like, it's easy to look at a list like this and be like, yeah, okay, that's right. I'm more of like an examples person. I remember that one of the women who was she wasn't an advocate, she was in macro level work, but was being severely impacted by legislation that was being handed down that impacted survivors in a really negative way. And one of the things she said to me is that I knew that I was starting to struggle when I found that I would forget to brush my teeth. And I was just like, well, that's like a duh moment. Like, you know, you get up, you have a routine, you brush your teeth, etc. And then I thought about it, and it was like, no, because even your routine becomes disruptive, right? And so I'm looking at this like the idea of rejecting like physical and emotional closeness and stuff like that, and just kind of thinking about, yeah, because you're irritable, you don't want to be around people, and at the same time, that's a shame, Like it's connected to shame in a really interesting way, in that as helpers, we're supposed to be the strong ones, right? And so, and I think that like I think almost everybody can relate to that, right? Like we're supposed to be the rocks. We're supposed to, we're not supposed to break down. We're not supposed to cry, you know? And so when you find yourself doing that, you stuff it in deeper and
Mhm.
you push it in, and it almost feels like a shame, like it's supposed to be shameful when you do have that moment of like breaking down. So instead, it comes out as anger. It comes out as irritability. But
Mhm.
really, what's behind that, that's the facade, right? And the facade is hiding this really. I used to have a mentor named Dr. Barato. He was a psychologist, and he used to say that anger was a response to vulnerability. And so that's the truth behind it, is that we're feeling extremely vulnerable, and we don't want to expose that vulnerability because we think we're going to be judged, and then it makes us somewhat weaker. But sometimes exposing that vulnerability is a way that we model for other people how to be in community with one another in a way that is supportive. Because we can say self-care all day, and honestly, what is self-care saying? Self-care saying is it's your fault. If you're breaking down and you can't handle the job, it's your fault because you're not taking care of yourself. But how do we do that if we're not creating an environment of care? If we don't have supportive agencies that are looking at care, collectively, and so it really, when I talked about institutionalizing, care systems, that is one of the negative impacts of taking, of scrapping the way that communities know how to do internal work, and saying, no, we're going to do it like this. We're going to create uniformity, and everyone across the board works this way. Because if I'm in a place where I have a little bit more water in my glass or whatever it is, right? Water in my bucket, like the kids are doing an exercise around bucket, like what fills your bucket? Um, then I don't mind sharing what's in my bucket with someone else, right? Because I know that one day they're going to pay it forward, right? I may have less, and I might be able to come up to them without feeling that sense of shame, without feeling like exposing my vulnerability is going to cause judgment, and they're going to step up and help me, right? So yeah. So I think that that's what I'm seeing here, is that a lot of these trauma behaviors, unfortunately, are things that are highly discouraged in our current societal model, and often break down severely across gender lines.
And how nice would it be in a helping profession if I'm never tardy? This is one example. And then I start being tardy. And maybe my supervisor, instead of saying, Amanda, why are you always late? What's going on? Or you can't be late. You're late all the time. Maybe considering, what have I done this week, this month at work? And saying, how are you? How are you doing? Asking more questions to then maybe get the root of what's going on. Eva talked a moment about vulnerability, showing this side of you and sharing or even being real with yourself is such a vulnerable place. And we are expected to be the one that's there on time, solving the problems, fixing things. That's why you come to me. Just recently, I had a client that I needed to reach out to CAN Community Health, and I went straight to them. Because I'm a problem solver. I didn't know how to solve it. And so I went and asked those people the questions, without acknowledging, how does that make me feel? Was I affected at all by the topic that I was dealing with? I didn't even consider that or think of that until later on. I realized, like, man, that bothered me. That did something to me. This slide talks about, interpersonal issues. You ever work in a place where you get hired somewhere and you see someone that's been working there for a long time? I worked in this office one time. I stepped away for about 3 months from social work. I was like, I'm done doing case management. This is a long time ago. This was like right when I started with my degree. I was like, I'm done. I'm done. And I worked in this office that People who have ice cream machines, like McDonald's, you know how ice cream machines always broke down? Okay, they would call me and they would tell me what parts that they needed. It was, God bless the people that work there. It was a terrible job. I mean, like, there were like 85 books that went to all these machines all over the US. It was really terrible. One of my coworkers that I worked with, she loved this job. She had been there for like 20 years. And she had a real hard situation, I will say, that happened there. And she went from loving her job to then she was the employee that, like, if anybody did anything wrong or it was not correct, even if they were learning, there was a conflict. And sometimes there was a conflict when there wasn't even supposed to be a conflict, like constant staff conflicts. And it was what was interesting to me is I found her, there was a change in the relationship of her job, what she was doing, and the love that she had at that point, I could see in her was no longer there. When I was in the job, I was sorry to her because I never had the love. That was not where I needed to go back to my calling, so I never had the love, but I saw someone go from having the love to not at all. And it was actually really sad. And it caused a lot of interpersonal issues on the job. And then even when she, even at home, it caused issues at home. And she didn't, I think in that profession, they certainly, we have a hard time talking about it, but in that profession, they're not talking about it at all. Mm-hmm. And it was very sad. It was, sad to see someone go through that. I know that when I surveyed the people that I surveyed in the last couple of days, my colleagues and people outside of the office, I hear them mentioning a lot of interpersonal issues, that they're having. A couple people mentioned issues with family, issues with partners, issues, getting along with other coworkers. And it was very interesting how the root back to it was this vicarious trauma, and acknowledging that.
I think another telltale sign for people in leadership is micromanaging, especially if they didn't if they really zero in and start micromanaging in a way that they weren't micromanaging before. It's usually in response to some kind of direct conflict that happened at the agency that's caused some discomfort, and often it can be linked directly to a traumatic experience. It's not, we're talking about vicarious trauma, so like the experiences of trauma that other people have had, but interpersonally, it also creates that sort of environment where people might hone in more on their staff as a way of control because they feel so out of control already. And so noticing changes in your leadership might also be an indication that they're experiencing some vicarious trauma.
A good example of that, I feel like I can be that way sometimes. And my new staff, they'll point it out and they'll be like, how come? And this Eva will understand. So with our rural grant, we have a lot of reporting to do, and we're happy to do it. Every 6 months, there's a really big report. And every 6 months, somebody in my office will say to me, are you okay? Are you all right? And the report is stressful. It's a little stressful. And because I have the experience before of maybe things that didn't go right or it was difficult, when it comes around every 6 months, people notice like, oh, it's that time. Amanda's shutting her door. She's not talking to anybody. And she's being pretty brief in her conversation. And I don't want to make light of vicarious trauma, but and I know that's not with a client, but this is a good example of how it feels, but to go with what Eva was talking about.
But as a leader, that's something that you can like acknowledge in yourself, right? And then like when somebody is I don't like to say calling you out, but like calling you in, right? Like the idea of
why are you acting crazy? That's
crazy. Like it's something that can be rectified, and I think that it's the same way with somebody who's showing signs of disconnecting, and often like they'll really bristle at you when you first try to reconnect. But a person who's disconnecting from all, like I see that a lot, like with closed doors, like an individual who used to have their their door open all the time, and now like their door is closed every day. Or used to go for walks with you and no longer wants to walk. You know, it's kind of like, how do you like, hey, I'm worried about you. Sometimes that's enough, and sometimes it's not. But I'm thinking about like that in terms of what the personal values and beliefs are, because if you can catch it earlier on and build up that sense of like those the resilience on that umbrella,
Yeah.
you can really avoid some long-term issues. And a lot of it does come from a sense of not feeling appreciated and not feeling like other people understand
Yeah.
what you're doing.
I have a mentor of mine, one-time mentor. Actually, was my first mentor in social work. Very first social work job I had, I was a social work assistant, and the social worker I worked with, amazing person, human mom, great person. Um, she went through a lot, and I really truly think that vicarious trauma changed her personal values, her beliefs in society and human beings, and the power of healing, the power of therapy, all those wonderful, beautiful things that she taught me. She walked away from the field, and it was probably a good thing if she wasn't going to be able to buy back into the work that she was doing in the helping profession. Um, and then she chose a profession, which I won't share, but it was a profession that is very opposite, in a role that is the most opposite of social work. And it's really sad. And in fact, I saw her emotionally dwindling down because of the things that she had been through with her job, with clients, that I personally have, like, I've had to let her go from my personal life, because it's such a vast different, and it destroyed her. And it really just changed her worldview. Her worldview now is just so different from the foundation that she helped me have as a social worker that was up and coming.
Yeah.
And so I do think when people don't have systems that allow them to deal with this, and the stigma sort of eats them alive, the probability that they walk away from something that they once loved so much, helping people, it's real, and it happens.
We also have a tendency toward confirmation bias, which is sort of the idea that when you already have a belief that you're starting to create, you'll look for examples about how that belief is true versus challenging it, right? Because nobody wants to be like, oh, maybe I'm wrong, right? Or we want to be right about the world that we live in. And so we won't look for ways to challenge. And so a good exercise is not only like practicing like daily gratitude. We do something at our house called highs and lows. So we want to validate, right? Like the way that like our days sucked, right? Like just like what happened today. And you know, and it's interesting because you can do this with the youngest person at in your household, um, and the oldest. Like it doesn't matter. And then so it's sort of like I like to end on a high. So it's like, okay, that was the low of your day, and often the lows can be like you can have like 5 of them. And so we've made it a rule that you have to share at some point something that was positive, something that was like the high of your day, even if it was something small, because practicing that daily gratitude, it keeps us grounded in that the world isn't a nasty place, or like that there's just as much goodness in the world as there is nasty. And so that's kind of something to start to counteract that schema that we're building in our brains.
The next slide, I think we have definitely touched on, you know, how vicarious trauma can affect your job performance, job productivity. One thing I wanted to hone in on, over-involved in details and perfectionism, and you know, we see that with someone who is experiencing vicarious trauma, then maybe they feel like, I'm so imperfect, you know, I was wrong, these are guilt and shame feelings, and so I'm never going to feel that way again, and I'm never gonna, I don't want anyone around me to feel like that either, so I'm going to do everything that I can to be the best over communicator. I'm going to do everything right every time, on time, even before I'm asked, and that doesn't last for long. that type of behavior, if that's not normally, some people are normally that way, I guess, but if you're not normally that way and it's sort of a symptom of what's going on because of vicarious trauma, that's not going to last forever in the person, and it can be very damaging for them.
That's a way to hide. Yeah.
Yeah, no way to hide. How do you know when to get help? When do you get help? How do I know? When is this so bad? My biggest thing is trust your gut. You know you more than anybody. You know, some people are even able to identify like 2 days before they're starting to feel sick. They're like, I'm feeling a little off. I can't describe it to someone else, but I know me. And the next thing you know, 2 days later, like, man, my nose is stuffy. You know, I'm sick. You know, it really is the same thing with this topic, trusting your gut. Maybe not every single time. I know that when my first experience of vicarious trauma, I had no idea what I was experiencing. So there were no guts to trust. But once I knew, once I was, well, like my daughter likes to say, once I was woke, then I was able to understand, like, okay, this is this again. This is affecting me. And one type of like rule that I like to have in my head when I'm talking to people, because I am a supervisor, and I do, you know, working with staff a lot. We're constantly doing case management, and I'm constantly listening for, you know, how are people feeling? Because I do care how people are, you know, how is this job affecting them? Are they cool when they go home, or are they not? How are we doing? And sort of that rule of, you know, is this something temporary? And do I see them, or do I see myself being able to cope? Am I doing the things that I need to do? Yeah, this bothered me because it's human nature. I'm human, right? And are we getting over it? It may not go away, but am I getting over it? Am I able to cope? Versus the individual 4 to 6 weeks later, they're still having nightmares. They're still concerned that this traumatic event that happened to their client, it is affecting them in some way, shape, or form, whether they feel like someone's going to come and attack them or whatever the feeling or thoughts are, they're still being triggered, and it's a prolonged amount of time. I would say that that's a good recommendation to say, like, I need some help. I need to really do something about this. I want to ask everybody who's here, anyone who would like to respond. Is your agency, hospital, wherever it is that you work, your nonprofit, your profit, wherever you are, is there anything set up in your agency or any dialogue about this? Is there any help? Are there any resources? You can unmute yourself if you'd like, or you can chat in. Oh, I don't even have the chat box open.
Hi, everybody. I'm MJ with Can Community Health. We have an open door policy like most places. We also have access to Work-Life Matters, which is part of our insurance carrier's way of incorporating an employee assistance program. I think it's really, really good. They do provide some mental health sessions, 3 preliminary ones, and depending on what the employee is contending with, then there are referral sources to finding something a little bit more, with a little bit more permanency, if that makes any sense, so they can transition from doing it there at that level to maybe in the mental health capacity through their in-network providers or out of network, depending on what the employee's comfort level is. And then, Amanda, you know, my office is always open, and I've created a space where even my colleagues, if they need a timeout, I've created a little cozy corner where they can, at any given moment, just drop in whenever the moment arises for them. And I encourage them on a daily. One of the best practices that I like to do with my team is just doing a morning emotional forecast check-in. Like, what's your emotional forecast today, guys? Is it rainy with a chance of meatballs? What's going on? Just really just doing that. And it really helps them to either help them check out from whatever's going on personally at home and check into the workplace so they can tackle the day, or even just take a woosah moment and check in with an intrinsic self-care check-in. Like, where am I at really this morning? I'm I'm really looking forward to 2021. I'd like to introduce a lot of trauma-informed care stuff, vicarious care stuff, like some really good coping skills, you know, for us as helpers, and just really emphasize that we are people helping people.
Mm.
And so automatically by default, we default to the same types of traumas, if anything. You know what I mean? So um, let's see where Ken is willing to do with supporting me in that endeavor. But you know me, Amanda, I'm quite the bulldog. I'm going to push through until something happens.
Always full of ideas. I like it. Eva said, I love the emotional forecast. I do
I
too.
love it.
That's great. And I'm sure that sets the office up a good morning. No matter how people are feeling, they might be like, I needed to hear that this morning, or they might be like, here comes MJ, but they can count on it. They can count on it, and they can be honest, and they can say, you know what, today is not my day. You know, and
Yeah. I'm a kinetic junkie. I love physics, so I got plenty of toys in the office. I
That's
just
awesome.
sometimes we just need to get busy with our hands and just in tune ourselves back into what I call a kinetic touch of the
Yeah.
self, safe touch. I'm all about safe touch because it's about healing.
Yeah. I love that. Those were such wonderful examples. I have we had a workshop earlier on the use of art we were speaking particularly to incarcerated incarcerated settings,
Mm,
but it applies here so much as well, and thinking about like how we've done it with um, adolescents, and also how healing it is just for adults too, especially if we're in a space where we need to reconnect with some of like that inner child energy that keeps us going,
yes.
that keeps us going. Yeah.
I
Yeah.
want to
So
make a sandcastle. Absolutely.
oh man.
Yeah.
Yes, exactly. Exactly.
Oh,
So it's
absolutely.
amazing.
I'm glad that you mentioned EAP. This was something Eva and I spoke about, and how important, what a great service that is. Somewhere private, someone professional that you can talk to unpack these things. Just because we're helpers doesn't mean that we're always going to um, understand, why am I feeling this way. We may need to talk it out with someone and say, this bothered me, and maybe I don't know why, or maybe I do know why, but I chose this job because I want to help people, but I don't want to talk about it. But now here I am trying to help people, and I need to talk about it because I can't help them while I'm feeling this way that I'm feeling.
Yeah. I think
Um,
Tay has a couple things that she's instituted, like even just first of all, I think like as leaders, right? Like we set the tone for a lot of how our staff members feel comfortable about requesting certain things. And so I love it when somebody like higher up the chain says something like, I'm taking a mental health day today, and really models that and like takes the stigma and the shame away from it. Because then the next time that I have to, like, I don't have to be like, hey, my kid's sick, I need a day off, right? Like, I'm not gonna lie about it. I'm just gonna be like, I'm really overwhelmed. I need to sleep in because I haven't been sleeping well, because I'm stressed, or because I'm burnt, I'm feeling burnt. Like I call it crispy. I'm feeling crispy today. So so I think that's that. And then we have she calls it like oops, and it's the oops or ouch moments, right? So if you have a member of your staff who is getting to that point where something's going on with them, and you want to give them feedback, but you don't want to set them off in a way that would probably do more harm for them, or would cause them to like clam up, and you kind of want to be funny about it. She says, so she'll say like ouch, and so it kind of cues that person into, you just said something that kind of hurt, and was I bristled at that. Whereas you yourself, if you're find that you're like in a grouchy space, or not able to deal very well today, like, and you notice that you've done something, and now you want to kind of like, you want to apologize, but you don't want it to be so serious that it like derails the entire, like, let's say meeting or whatever. You might say, oops, that's not what I meant. Like, I'm gonna take it back. So So there are like very simple things like that, little techniques like that, that I think really help in management, but also in just like being a good team member, to kind of be forgiving of each other and create like that community of care that we're talking about.
And keyword management, managing it for yourself, managing it as appropriate and as much as your colleagues will allow you to be helpful to help them manage and cope.
Yeah.
There is hope. There is hope. There are things that can be done. This topic can be really doom and gloom. And as I spoke to people and I did research, I kept reading doom and gloom, doom and gloom. In the limited research, I will say there wasn't a lot to pick from with vicarious trauma, not enough like there are in other topics. Yes, there was a lot, but there wasn't like a lot. I had to keep digging for what I was looking for. And what that tells me is I would dare to guess that some years ago, there were probably many professions, helping professions, that never ever spoke about this, ever. And so,
Well, I mean, and the reality is that vicarious trauma is essentially your brain experiencing exactly what you're hearing somebody else experience. The same way that when you read a book, you're able to put yourself in a character's shoes, or when you're watching a movie, you're disconnecting. They've done studies on brain imaging that make it clear that there isn't really a difference in the way that the brain experiences that versus the way that the person experiencing, if you're doing your job right, which is, that's the job of empathy, that's the job of being a helper, is putting yourself in that person's shoes. And unfortunately, like you said earlier, there are unintended consequences to that.
and it's some, some people, they give that. And it's an old saying, I know it's cliche to say, but you can only give so much before you don't have any to give. You can only be so empathetic. If you have not recharged yourself, you might not have it to give, but there is hope. It is solvable. It isn't all doom and gloom. Having self-care plans, looking for support, and advocating. When I see the word advocate, I think about what MJ is doing in his office, advocating also for not only, that those check-ins, I know they are for him also, but they are for the people around him. It is to take care of the helpers around us, and seeing what can we do as an agency, as a group of people, to check in and make sure that we are okay with what we're doing, with what we're helping with. Next slide. I like this little saying, self-care is not about self-indulgence, it's about self-preservation. Making sure that I can go on to the next, preserving myself, so that I have the energy to help the next person, and being intentional about our self-care, like not just doing something because this is what I do on Friday nights or whatever, but like I'm in control of this. I can do this. I am acknowledging what's going on, and there's an intention behind it. That way it doesn't go unnoticed. I think sometimes we get into self-care, trying to feel better, that it's like, oh, it's just something I do. It's a buzzword, but if I really acknowledge why I'm doing it and the intention behind it, you might be like, okay, the reason I like to work out is because it does make you feel good. I'm not just doing it because of peer pressure, I'm not doing it because everyone else in the office is doing laps. It does do something for me. Here it says, redefine self-care as a unique experience. Whatever I love, and it's a whole different topic when we could talk about self-care, all day long. I love hearing what people do. It gives me ideas. I will say, one thing that we have only briefly mentioned is self-care is very different for some of us right now. Not to make light again of vicarious trauma, but if you show me this in a couple of years, or this, or some Lysol wipes, I'll be like, oh God, 2020. I remember 2020. My self-care thing if you saw me a year ago, I'd be like, Netflix, I'll watch it. I like to watch a season of something. I feel good. You know what? COVID has robbed me of that, because I have watched so much Netflix. Is there anything else to do? What else can I do? Because I realize I like to go out to eat a lot. There are other things that I like to do that I can add as self-care once the world comes back to what it was. Netflix won't be it, but redefine self-care, make it a unique experience for you, and talk about it with other people. You get good ideas. Heroes need help too. I've said this over and over and over again because it's so important to me. Taking the stigma away from us that are helpers, us that are heroes, getting the help that we need, and really reaching out. There's nothing wrong with talking with a therapist. I just don't understand it. Sometimes when I run into people that are in the helping profession and there's still that stigma of going to a therapist, you know, and I'm not sure how that happens, but it does happen, and it's things we don't talk about. And it's okay getting that support. EAP is a great resource, but even if those 3 sessions aren't enough and you have to take the referral and continue talking to a therapist, that's great. I think a good helper needs a good helper in their life, and specifically in the jobs that we work. They're hard. They're not easy. Eva, was there anything you wanted to add to that, to seeking support?
Yes, I was going to put in the I am going to put it in the chat, but something that, you know, there is conversation, we are having conversations sort of in the background of these movements. And one book that I think is helping shape a lot of where I hope will go as time kind of traverses is Adrienne Marie's Brown's work on emergent strategy. It's called. She's a woman of color and is really centering folks of color in terms of like, how do we stay in the movement when the movement can be so painful. And so I think about like that can really be can be applied across the board here. Like, how do we stay in the movement when the movement is so painful, as helpers, as people with lived experiences of trauma, as, you know, X, Y, and Z. And so if you haven't heard of her before, I recommend her work on emergent strategy. She also has another book called Pleasure Activism that centers the idea of pleasure in your work. Not like that, you know, thinking that that pleasure is something that you do after work, right? Like, how do we make the work that we do pleasurable so that we can stay connected to it? And so she's also written a separate book that talks a lot about the concept of longevity, like how do we stay in the movement? And a lot of that is by centering pleasure, right? And so I love some of the examples that Janelli gave, because I think that that's exactly what you were talking about, is like, oh, I'm really a sensory person. So how do I provide experiences for like kinesthetic and sensory experiences right here in my office? Like, so people can be like, you know, this is a nice, safe place to retreat to when I'm feeling overwhelmed from in the world. And so I'm just going to kind of add that onto the chat.
MJ had put on the chat if people would be willing, and I want to be mindful of people's time. I'm not going to keep you much longer. But if anybody wanted to share one thing that they do for self-care, and his ideas, you know, for self-preservation. Tell anybody want to share something that they do? Eva, what do you do for self-care?
I'm involved with several community gardens in Tallahassee, and which we're centered around. It's interesting because it's more activism, but it helps me too. So I get a good workout. I also get to grow plants. And then what we do is we create medicinal remedies for folks who don't have access to healthcare. And so I like making things with my hands. So I'll create salves, I'll create teas, and then we give them out for free, like to the community. So it's community helping community. So it's a lot of like mutual aid kind of stuff. And then we also take cuttings of those plants and create new plants from them. And so if you've ever heard of the concept of little free libraries, which are like everywhere now, we took that concept and now we're adding like a plant section to it where folks can either drop off plants that they have and want to share, or they can take plants. And then we have information on like the medicinal uses of those plants if they want to like sort of, and it's kind of like a self-sustaining model because you can grow the plants easily, you can take seeds from the plants. And so it's about teaching like preservation, but also engaging people in staying connected to one another and to the earth. So
That's good. I like it. I see in the chat box a couple people saying a couple things. Someone said meditation, golf, reading, spending time outdoors. I know that for me with self-care, I know that I am not doing self-care when I claim to want to always, 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 always be alone. Like I'm fine leaving alone, I want to be alone, I want to be alone. I know that I'm not doing self-care because I like people, I want to be around people, I want to be near them, I want to know what's going on, I want to say hi. And that's how I recognize that I'm not doing something that I love, which is being around other human beings. Thank you for that, MJ. The next slide there, I gave some reading materials. Trauma Stewardship is such a good book, and it's even something that you can do in the office. And it does apply to, I know everyone in here, they are a partner of us in some way, shape, or form. They are touched by survivors of sexual assault. But even if that's not your primary role, I know that you all are dealing with trauma in one way or another. And this is such a good book that you can even do in the office. There are some activities and group conversations. And then another one is the Empowered Advocate. The last slide we've already touched on. I touched on it earlier about advocacy and empowerment. You know, what can you do to support, collaborate, educate colleagues, your program, the agency? I think, you know, it's sort of a movement to kind of say, hey, this is something that happens to people, certainly in helping profession, no matter what you are, nurse, victim advocate, whether it's a rape crisis center, domestic violence center, or it's at, you know, local law enforcement. What can you do? We're all dealing with trauma, and what can we do to foster an environment that's healthy for one another so that we can grow from these things instead of you know, melting and maybe potentially, you know, walking away, like I said, from something that you really love to do. You just need a little help. And that is it. This contributes to what MJ was asking. Here's 50 ways to take a break. And this is just if no one has reminded you, I'll remind you today, take care of yourself. Worry about you. It feels selfish, but it's not. And we tell this to our clients, our patients, our participants. I know you all. I know most of you on here, and I have seen most of you in action. And I have seen you tell people, worry about you. But what about you? What about you? What about me? Worry about ourselves and take care of ourselves. And then our final slide is some resources of different things that we used. Shout out to Resource Sharing Project, which is a wonderful project that deals a lot with the rural communities and sexual violence. But we've got some resources, and everyone that's on here knows how to reach out to me. I've reached out to you. Thank you so much for coming today. And then Eva, would you share your information if anybody would like to reach out?
I am on it. I was writing it as you were talking.
Okay.
So that is my email. Again, I'm at the Florida Council Against Sexual Violence. And yeah, just feel free to reach out if you ever need like ideas, brainstorming sessions, really anything. We can set up a call, or we can just chat on the phone, whatever is easiest for you. We really appreciate your time. I know that the other thing is like time away from computers lately, right? So we recognize that this is a gift of love from you to spend this time with us, particularly when we're already so technologically bombarded. So thanks again.
Thank you all very much. I appreciate you. Hope to see you all soon. Bye-bye.